My name is Anand Deva. I'm the head of plastic and reconstructive surgery here at Macquarie University, and I want to talk to you about breast implants. Now, this is something we know a lot about. We've spent close to 20 years researching breast implants, safety, and how to give patients the best possible outcome after surgery. So let's say you've decided you want to have breast implants for whatever reason. Then here are some of the pointers I can give you in terms of what to ask your doctor before you decide to proceed down that path. I think firstly and most importantly, you need to have some sort of rapport with the doctor providing the information to you. I think that's really important. One of my mentors actually said, it's important as a doctor that you actually like your patients. So look for that when you see a doctor. The other things relate to, I think, a complete disclosure of the doctor's experience, the doctor's training, and also some idea of what the doctor's outcomes are like. And I think the best way actually to vet that is to ask to speak to patients, other patients the doctor has treated, or once again go to your general practitioner. GPs are in fact the best port of call because they see results from many different doctors. So what would you be wanting to know if you were thinking about breast implants? So let me tell you firstly that breast implant surgery actually covers two areas. One is actually to restore breasts after cancer has been removed, and the second, of course, is breast implants as a cosmetic procedure. So they're both very different, and I think that let's focus a little bit on the cosmetic indication first. So a lot of women come to us and want to have breast implants, and I guess the first question I ask is why, and we hear a number of different reasons. Some women, I guess, have had children, their breast has changed both in terms of volume and position, and they feel they would like to restore their body back to what they had before. And certainly breast implant surgery can do that. Other women, I guess, are a bit younger, they haven't had children, but perhaps may not have developed breasts, and they may look out of proportion, and certainly breast implants can help do that. So focusing on the reasons as to why you want the surgery is important. So what we've shown once again through our research is that it's really critical that the person who is doing the procedure is well trained, uses the best possible techniques, uses the best quality implants, but actually most importantly offers some sort of ongoing follow-up. So I don't think it's good enough now for someone to put an implant in a patient and then send them off on their merry way. So we've actually introduced a world first here where we are allowing women who've had implants wherever to come and actually be checked regularly. This is a new concept, but it's a concept that's very close to my heart. And I'll let you know that, in fact, all the patients I've operated on over 20 years see me every year. We kind of grow old together, which is kind of fun. But actually, more importantly, I can track these implants, track the way their bodies changed, track the way the implants changed. And so for me, that's a source of good information for the patient, but also an opportunity to pick up problems and deal with them early. The most important reason I follow up patients is a selfish one, and that's because I feel that patients actually teach me stuff. As I see my results over time, I've used that to become a better surgeon, and I think that really is a good function of follow-up as well. So let's say you have breast implants, you have not had them checked, and you are worried that something might be going wrong. So once again, here are some important steps that you can take. Firstly, I think go and see your GP. They can perform a physical examination, organise imaging such as an ultrasound to check to make sure everything's okay. If that's something that you can't do, then go back and see your original surgeon that put the implants in. I think it's important that they see and advise if there's anything going wrong. Now, of course, there is now a third option. At the Integrated Breast Clinic here at Macquarie University, we've begun a service that's actually brand new, not tried before anywhere else, which is where you can get your implant checked by our breast physicians, well trained to pick up implant-related problems. So if you needed to go there, go to the website, Integrated Breast Clinics at Macquarie. So you might have heard in the news or read in the news that Macquarie is actually one of the world leaders in breast implant safety research. We've spent over 20 years looking at the issue of capsular contracture. Now, those of you who don't know what that is, it's the commonest reason why women come to us after having had breast implants and having to have more surgery. So what happens over time, and this doesn't happen immediately, you might have quite a nice result to start with, but then as the years roll on, implants become hard, become painful, and eventually cause deformity. This is due to almost like a scar tissue that forms around the implant and squeezes the implant until it causes problems. We've shown, actually through some very, very good research, that it is due to the contamination of these implants with little bacteria. When they grow on the surface of implants, the body can't get rid of them, and so it causes inflammation, which eventually causes this capsular contracture. So the research that we've done, and this is a good example where if you understand something and understand the science as to why something happens, you can actually, as a doctor, take that understanding and pass on a benefit to patients. We've published back in 2013 the 14-step plan, or the 14-point plan, and these outline specific strategies surgeons can use to reduce the level of bacteria attaching onto your implant. So if you are going to have surgery, just make sure that the surgeon who's doing it knows about how to best reduce bacterial contamination. If you need more information on this, firstly, we'd recommend going to your local doctor. They're a good source of credible information in terms of implant safety. But down below are many links to more information, so you can be up to date with the latest. You can always come to our website or alternatively get in contact with us at Integrated Breast Clinics at Macquarie University.